Hi everyone, my name is Shehla Rooney, and I am a physical therapist with over 26 years of clinical experience. I specialize in knee replacement recovery. I get asked all the time so many things about knee replacements. When will I be able to walk without a walker or a cane? When will my knee stop hurting? When will my knee feel normal? When will I be able to do the things that I want to do? All valid questions, all good questions to ask before having knee replacement surgery. So let's get started. Let's talk about what can you expect after knee replacement surgery. Well, first of all, you're either going to be in the hospital or have outpatient surgery. That means either you get admitted for a few days or you drive up that morning, you have surgery that morning, and you go home later that day. That's called outpatient surgery. There's definitely a trend shifting towards day surgery for this surgery, but it will depend on your surgeon and your individual circumstances and probably your insurance and where you live. But you'll either be admitted to the hospital or you'll have outpatient surgery. You can also expect to have physical therapy on the day of your surgery. Don't be scared. They're going to show you how to get in and out of bed, up and down from a chair, how to use a walker so you can walk in the hallway and make sure you use that correctly. They'll show you some basic exercises on what to do to bend your knee and what to do to straighten your knee. They usually also show you how to go up and down steps. Again, no panic. It's probably one of the easier things to do. We kind of teach you how to compensate for that surgical leg, so it's not that stressful on the leg. And they'll make sure you can get in and out of a car. And all of this will be done before you leave the hospital. Now, whether you receive home health or outpatient physical therapy will depend on some things. So outpatient physical therapy is someone drives you to and from the therapy clinic. So obviously, if you have someone that can easily transport you from your house to the physical therapy clinic, then more than likely the doctor will order outpatient physical therapy. If you don't, you live alone or don't have someone that can drive you to and from the clinic, then they're going to order home health physical therapy, meaning someone will come to your home and do your therapy there. I don't have a strong opinion either way. Some people say, oh, it's more aggressive in outpatient versus home health. I disagree. I think it's completely dependent on the physical therapist that you get and the quality of care that they give you. Obviously, you're going to have some sort of a protective bandage over your new surgical wound. Usually it's self-adhesive, sometimes it's clear. It's all dependent on your surgeon and what their protocol is. Point is, you won't touch it. You'll just leave it on there until they give you instructions to do something otherwise. Obviously, after any surgery, there'll be some bruising. Some people have massive amounts of black, purplish bruising all the way up their calf and back of their leg. Some have minimal bruising. Again, it's individual and it depends, and it's completely normal. If you do have a lot of bruising, no worries. Over the next few weeks, it will slowly probably transition to green and yellow and light brown and eventually go away. Nothing to worry about. Another thing you can expect after knee replacement surgery, the obvious one, which is pain. Pain happens with any major trauma to any part of the body, so this should not be unexpected. My major thing about this is take the medications. Some patients tell me they try to wean off the medications quickly because they think somehow that's a rite of passage or makes them, tougher, but it doesn't. Take the pain medications that are prescribed, unless it's contraindicated for some reason, because it definitely makes the tolerance of doing the exercises better. So take the pain medications because you are going to hurt, but it'll help manage the pain for you if you stay ahead of it. Another common thing to expect after knee replacement surgery or any surgery is swelling. And swelling causes pain, so you definitely want to get ahead of the swelling. Your ice and elevation are going to be your best friends. You're going to want to do that frequently throughout the day, maybe every hour for the first week to control the swelling. Some patients say that the more they move the knee and the more they walk, the more the swelling they have. It's normal. Swelling can last for months after the surgery, some people even longer than that. It is a normal response to surgery, so no worries. You will have swelling after knee replacement surgery. Next, we're going to talk about range of motion. What does that mean? Your knee does two primary motions. It bends and it straightens. So that's going to be the main focus after knee replacement surgery, is to figure out how to get your knee completely straight and then how to get it bending. The goal is 0 degrees means fully straight, and about 130 degrees is considered normal and really good after knee replacement surgery. So those are some numbers you want to kind of keep in mind, 0 to about 130. Obviously, it'll take time to do all those things because your knee is swollen and stiff, but that's the goal. The key to getting this range of motion back is exercising every single day. And not once a day, not twice a day, not 3 times a day, but almost every hour that you're awake, you should be doing something to that knee. You should be bending it, you should be straightening it constantly. If you bend it for too long, then you'll have trouble straightening it. If you keep it straight for too long, you're gonna have trouble bending it. And that lasts for at least a few weeks. It is normal, nothing to worry about, but just know you're going to be uncomfortable, it's going to be difficult, but you didn't have this surgery to take the easy way out. You had this surgery to get back to life. So it is going to be difficult, but with perseverance and a commitment, I sometimes tell my patients, like, this is your job, 40 hours a week, 7 days a week, whatever you want, but your job is to get this knee bending and straightening. It's short-term pain for long-term gain. Now, the good news is after knee replacement surgery, you will be able to do things like get in and out of bed and get up and down from a chair. You'll be able to walk the day of surgery, and you'll be using a walker, but you'll be able to walk. And I sometimes need to remind people that this is important because there's a lot of other surgeries out there that have major restrictions. Think about it. If you have shoulder surgery, your arm is put in a sling and you're not allowed to use it. If you have an ankle fracture, more than likely you're going to have a cast on and you're not allowed to put any weight on it. Back surgery, tons of restrictions in terms of no bending, no twisting, no lifting. So the great news about knee replacements is there are no restrictions. The only thing you need to not do is do not fall hard on your newly replaced knee. Other than that, you're allowed to bend and straighten as much as you want. Sometimes I tell patients, and it's shocking, but in the surgery, your surgeon has fully straightened your knee and fully bent your knee before you ever come out of there. So that is what you're meant to do. After knee replacement surgery, obviously you're going to have physical therapy. Usually it's about 2 to 3 sessions a week that last between 45 and 60 minutes. And usually this goes on for about the first 4 to 8 weeks. I find that most patients have a love-hate relationship with their therapist. They love the results and they sometimes love how it feels when their leg is bending and moving, and the tricks and the modalities that we use makes it feel better. But the hate is they don't like the process of how it gets there. But the key is not what we do with your knee in clinic, it's what you do at home every day that's really going to matter. So the most important thing is following your physical therapist's instructions on your home exercise program. Again, bending and straightening your knee all the time, every day. That's the key to a faster recovery. And before you know it, you will be resuming activities that you had stopped doing years ago. Or maybe you'll be starting new activities, like learning how to play pickleball. But the point is, being able to go back to golfing or traveling or bicycling or walking with your best friend around your neighborhood, whatever it is, in no time, you're going to be able to do those things. So even though the recovery is hard, think about it. If you didn't have the surgery, then your knee pain would continue to get worse. Osteoarthritis does not improve. It continues to worsen. This pain is acute. It is short-lasting. It's going to be there, but as you move and progress your knee, it will get better and better. That's the key difference between having the surgery and not having the surgery. I will say that it is a gradual process. The recovery can take a long time, but please do not compare yourself to your neighbor, your relative, or anyone else that you know that's had a knee replacement surgery. This is very individualistic and it changes from person to person. So please do not compare. It can either set you up to feel really bad and disappointed or discouraged, or it can inflate your ego to think you're doing way better, and you can ease off. It's not the case. Every person is different. Every recovery is different. Let's not compare. So I've talked about, what to expect after knee replacement. We've talked about the pain. And again, I'm going to remind you that pain is short-lived. It will get better and better with the more that you do. So that's a great thing to hear. I know that the level of discomfort, and I keep using the word pain, but you need to understand that your bone has to grow into this new implant, and that process itself can take up to 3 months. So some people are like, oh, I was doing so well, and now the pain is still here, and it's been months since the surgery. It's just a process. Your bones take a long time to heal and to grow into this new implant. Just be patient. You will reap the rewards of this new knee in no time. So think about it. A few weeks or maybe even a few short months of difficult and challenging times and hard work to possibly have 15 to 20 years of good use out of this new knee. I think that's a great investment. And again, I strongly encourage you, put the work in early. You will reap the rewards for later. So That's what to expect after knee replacement surgery. You're gonna have pain, you're gonna have swelling, you're gonna have stiffness. It's gonna be hard, but it's totally worth it. Imagine getting that life back, doing the things you want now. So, wherever you are on your knee recovery journey, good luck.